Welcome to our mnemonic video on the differential for ankle and foot injuries. Let's get started. This scene takes place in a jungle in South America with the famous Mr. Indiana Jones. He has finally discovered the missing feet of all the Easter Island statues. And let's start with the first statue that Mr. Jones has discovered. And you can see he is observing a large foot-shaped statue that has a small crack midway on the left side of the foot. This crack being observed by Indiana Jones should remind you of a Jones fracture, a fracture between the proximal and middle parts of the fifth metatarsal bone. A Jones fracture usually happens when the foot bends inward while the toes are pointed. And this kind of movement tends to occur in motions requiring a change of direction while being on tiptoe, like in basketball or dancing. To drive this point home, here's the articulation of the fourth and fifth metatarsal bones. Think of it as the place where the bones of your pinky toe and fourth toe meet. Let's take a closer look to get more specific. If we draw a vertical line through the articulation, it will look like this red dotted line. And if we added another line perpendicular to the base of that articulation, extending laterally to the edge of the bone, it will look like this blue dashed line. Now the zone distal to the dashed blue line, which corresponds to the level of the fourth and fifth metatarsal articulation, is highlighted in red. This red zone is where a Jones fracture will be located. And Indiana Jones, peering at the crack in the red zone of the statue, should remind you of a Jones fracture, which is on the differential of an ankle and foot injury. Now let's clear that ink and move on to the next statue. A little further in the distance, we can see another explorer. This one is dressed in a showy costume. He is really just an imitation of the real Indiana Jones in front of him. And we can tell that this guy is just a hack because he's using a chisel to chip away at the precious statue, unlike Indiana Jones, who wouldn't do something like that. And the statue in front of this fake Jones guy is also very similar to the real Jones statue. One little detail is different though. The fifth metatarsal on this fake explorer's foot has a crack starting at the proximal edge. This fake Jones, or pseudo-Jones, should remind you of a pseudo-Jones fracture, which can also be termed an avulsion fracture. Okay, so you need to know that a pseudo-Jones fracture is different from a Jones fracture, but you also need to be able to distinguish a pseudo-Jones fracture from an apophysis. Now, apophysis is actually just a normal secondary ossification center. And if you look at it on an X-ray, it'll actually show this translucent line in a very similar location as a pseudo-Jones fracture would be. So this proximal end of the base of the fifth metatarsal. However, an avulsion fracture, or pseudo-Jones fracture, is obviously pathology, whereas an apophysis is a developmental normal thing. It just represents a normal secondary ossification center in adolescence. So, if they both have translucent lines in this same area, how can you differentiate the two? Well, an avulsion fracture is perpendicular to the metatarsal axis, while the apophysis is more parallel to the metatarsal axis. Another way to think of this is that the apophysis is parallel to the diaphysis of the fifth metatarsal, or parallel to that line of articulation that we drew earlier, that red dotted line. Now that we've learned how to differentiate an avulsion fracture from a normal apophysis, let's take a closer look at how to differentiate the avulsion fracture, the pseudo-Jones fracture, from a real Jones fracture. Let's again bring in the imaginary lines that we drew on the previous statue. This time, our statue has a crack in the blue zone of the toe, which is the area proximal to the level of articulation between the fourth and fifth metatarsal bones. And if we bring back our ink on both statues, we can take a look at that perpendicular line that runs to the base of the articulation between the fourth and fifth metatarsal bones. And the pseudo-Jones fracture is proximal, while the Jones fracture is distal. The reason why this distinction is important is that a Jones fracture has a higher propensity for non-union due to the nature of its blood supply being a watershed area, unlike the pseudo-Jones fracture. So each of these fractures will actually be managed differently. For example, a Jones fracture may need surgical realignment of the bone to help with healing, whereas a pseudo-Jones fracture is treated conservatively. Finally, there's a third type of fracture on the fifth metatarsal bone, and that also occurs distal to the red zone, and we've highlighted that in yellow. Now, fractures in this area are known as stress fractures, which, just like Jones fractures, carry a high risk of non-union. Now let's clear that ink and move on. Going back to Indiana, it seems like the journey to his discovery actually wasn't that easy. Take a look at his gladiator sandals and you'll see why. One of his sandals is torn up in the area where the Achilles tendon is located. This idea should make you think of Achilles tendon rupture, another cause of an ankle and foot injury that you should keep on your differential. Coming closer to Indiana is this gazelle here to feed on grass. This gazelle is a Thompson gazelle, which should remind you of a Thompson test, also known as Simmons test, part of the examination for rupture of the Achilles tendon. A positive Thompson test is when squeezing the calf of the injured leg elicits no movement in that foot. For example, if you squeeze your calf, then you'd expect your foot to go down, as though the calf muscle was contracting and pressing the foot downward. But what brought this gazelle that close? Well, it seems like this Thompson gazelle is curious about Indiana's unique flower staff that he discovered in one of his excavations. The flowers on top of the staff are our symbol for fluoroquinolones, which increases the risk of Achilles tendon rupture in the elderly population. So putting things together, an Achilles tendon rupture can be precipitated by fluoroquinolone use and is detected on the physical exam by a positive Thompson test. Now the question is, how did Indiana Jones come to know about this place? Well, it looks like Indiana has been following this mysterious map, which led him to this area. Indiana Jones is closely inspecting this map, fittingly shaped like the bony outline of a foot, to see where he should go next. He is ready to keep exploring, and he has some hot dogs or Franks in his hand as a quick snack to eat on the go. Well, Franks should remind you of a Liz Frank injury, and that's a type of injury that we're going to be discussing on this map. On the left side of Indiana's map, we can see a drawing of a bridge, which corresponds to the bridge in the upper left corner of the background. That means that this red X on the map marks the spot where Indiana Jones is actually kneeling. And if we look closer at the map, we can see that the bridge is broken, with red marks outlining each edge of the broken bridge. The broken bridge was connecting the region where the second metatarsal bone meets the tarsal bones of the map. This idea here should remind you of a Liz Frank injury, which is a tarso-metatarsal fracture, and it results in the dislocated articulation of the medial cuneiform and second metatarsal base, which is another injury you want to keep in mind on your differential for anybody that comes in with an ankle or foot injury. Now, off in the distance is our next statue to be explored. It looks like the calcaneus bone forming that heel has some cracks running through it. And that should remind you that a calcaneal fracture should be another thing you should keep in mind when somebody comes in with an ankle or foot injury. And let's move on to our next statue. And this one has not been disturbed in a long time and has dusty cobwebs all over it. This statue looks very similar to the tibia and fibula of a human leg. And we can see that there are some cracks along the fibula specifically. These cracks are here to remind you of fractures, and the spider webs below should make you think of a Weber fracture or Weber fracture. And that's the next fracture that you should keep in mind on your differential for a patient with an ankle or foot injury. Now, Weber fractures are further classified based on their location relative to the distal tibiofibular syndesmosis. And that tibiofibular syndesmosis is a part of a fibrous joint between the lower end of both the tibia and fibula, and it's supported by the following ligaments: the interosseous ligament, the anterior and posterior inferior tibiofibular ligaments, and the transverse tibiofibular ligament. However, the posterior inferior tibiofibular ligament is the only visible one in our statue here, as depicted by this oblique web here. Now let's draw some imaginary lines, which will separate the fracture into 3 levels: above, below, and at the level of the syndesmosis. These sections are highlighted in green, purple, and red to make it easier for you to visualize the fractures. The fractures are classified from most distal to proximal as follows: Weber type A fracture, shaded in green and distal to the syndesmosis. Weber type B fracture, shaded in purple and is traversing the syndesmosis. Weber type C fracture, shaded in red, is proximal to the syndesmosis. So let's clear that ink and move on to the next statue. It looks like this statue has been damaged by previous expeditions. Now it has cracks all over it. And over there, we can actually see some mason jars filled with debris from the statue. Well, mason jars should remind you of a Maisonneuve fracture, which is something else to keep on your differential for foot and ankle injuries. A Maisonneuve fracture is a spiral fracture associated with tearing in the syndesmosis and interosseous membrane, with occasional damage to the medial malleolus or deep deltoid ligament of the ankle. Maisonneuve fractures are generally seen in situations where violent external rotary force is applied, specifically applied to the deltoid and syndesmotic ligaments. Now, tearing in the syndesmotic ligament, does that sound familiar? Well, it sounds somewhat similar to the Weber fractures we discussed in the previous statue, doesn't it? However, an important distinguishing factor for a Maisonneuve fracture is that there is an involvement of the proximal third of the fibula. And in fact, this statue has a crack at the proximal third of the fibula and a red line marking the tear through the interosseous membrane all the way through the syndesmotic complex and into the deltoid ligament. Now let's take a look at the brain of this operation, the Exploration Party tour guide. This guide has led many archaeological parties through these jungles before, but this time he's tripped on some loose rubble lying around on the dig site. However, it's just a sprain, which is an injury to the ligaments that does not involve damage to the bones. The ankle sprain is common and should be on your differential for foot and ankle injuries. It can be treated using the RICE method, which is a mnemonic. So the R in RICE stands for rest, I for ice, C for compression, and E for elevation. RICE, RICE. And this RICE treatment method is partially applied by our tour guide here, as we can see him wrapping his leg for compression, and he's kind of elevating it. Now let's take a closer look at the rubble that has caused our tour guide to trip in the first place. At the bottom of this scene is a pile made of other smaller stony statues that resemble legs and feet. They are all damaged, but it's hard to identify any specific features in these statues or what sort of damage they sustained. Well, this idea should remind you that in addition to all of the differentials we've just discussed, there are actually so many injuries that can occur at the ankle and foot, but you should always at least consider the ones that we've talked about in this story. And that concludes our video on the differential diagnosis of ankle and foot injuries. See you on the next expedition.